Hello everyone, I am Bacleon, a student nurse from Davao Doctors College. And today I'll be assessing the eyes, which is an important organ for our sense of sight. So prior to conduct of this assessment, I am going to review my client's previous medical record if available. And this is done to identify instances of harm to patients, his medical histories, and current treatment procedures. Second would be to determine the scope of this assessment and prepare the necessary equipment to conserve time and energy. And for this procedure, all I'm going to need is the Snellen chart, of course my pen light, and this third is going to perform a hand hygiene to protect my patient and myself from infection and cross-contamination. So now, I'm going to introduce myself to the patient and verify the client's identity. So good morning, sir. Good day, sir, rather. May I see your wristband, sir? Please state your complete name.
I am EJ Mimako.
Your birth date.
August 4, 2004.
Thank you. So, sir, how would you like me to call you po?
You could call me EJ.
EJ. So, Sir EJ, so today I'll be doing an eye assessment. So I'm going to check now how clear and how good your eyesight. And is to check if there are spots or angles which you have trouble seeing, okay? So during the conduct of the assessment, I might need to ask you some, you might to stand up or sit down and read something or shine light in your eyes, and also document all of the result, and it will be kept confidential. So do you have any questions or further clarifications?
I have none.
Okay, thank you. So for the privacy of the patient, so since I am here in the a public area of the house, so I will no longer do a privacy for the patient. So now I'm going to check for use of any visual aids prior to starting the test. So sir, may I ask if you have any contact lenses, or do you have you wore glasses to
No,
your eyes?
I don't use anything.
Okay, thank you. Alright, so I'm going to ask the patient to stand 20 feet from the Snellen chart and then cover the eye being tested. Ask the client to read each line until he cannot decipher the letters. So prior to the procedure, I'm going to use a cardboard to cover each individual eyes to see the Snellen chart. So sir, please stand here, sir. Okay, sir. So sir, please cover your right eye first, and then please read the Snellen chart.
EFDOZLPEDP ECFDFE CFDFE LOPCD DEFPOTEZ PEC.
Okay, thank you. To the left eye, sir.
EFBDOZLPEDP ECF DFE CFDFE LOPZD DEF POTEC.
Okay, thank you, sir. Now in your both eyes, sir.
EFBDOZLPETP ECFDFE CFDFE LOPZD DEF POTEC.
Okay, thank you, sir. You may now sit down again. So now my client has the vision of 20/20 vision. So since my client has a normal vision, he will no longer do another visual tests anymore. So, alright, so now I'm going to face the patient directly to a distance of 2 to 3 feet. Okay, sir, what I need you to do is just to look straight up to my eyes. So I will sit in here. So what will you do, sir, is to look at straight into my eyes and then spot my fingers to into your visual field, okay, sir. So see, okay, sir, if you says see it, sir. Huh?
Okay. Okay. Okay.
Okay, thank you, sir. So I sense that you have a normal vision, sir. So you've already seen my eyes and my hands tingling into your side of vision. So after that, I'm going to inspect the eyes for alignment and symmetry. So, sir, look into my eyes, sir. Okay, I see that your eyes are symmetrically normal, and then the distribution of your eyebrows are okay, it's normal, and your let me see, and your eyelashes is curl up upward, so it's normal. Okay. So now I'm going to inspect the area over the lacrimal gland and lacrimal sac for the swelling. So I'm going to palpate for the nasal lacrimal ducts and lacrimal glands. So, sir, I'm going to touch your answer. Okay. So, now I'm going to assess the sclera and bulbar conjunctiva. So I will ask the patient to look up. So, sir, please try to look up, and then we'll check the. Okay, sir, it's normal. So next is I will going to invert the eyelid to assess the palpebral conjunctiva. So I will look down, sir, please. Okay, thank you. So now I'm going to inspect carefully each iris and pupil. Now look straight into my eyes, sir. And then okay, thank you. Now is to inspect each cornea and lens for clarity and texture. So I'm going to use my pen light to check the cornea and lenses. So, sir, please look into the answer. Okay. Okay. So now I will close the light. I will going to need I've already shined the eyes of the patient. So now I'm going to assess assessment of the pupil reaction to accommodation. So, sir, what I need to do is to focus on the tip of my pen light, and then I'm going to you will go focus into my tip of the pen light and look at the deep wall, and then look at my tip of the pen light, look at the wall, and look at my pen light. Thank you. After that, I'm going to assess the patient using the Hirschberg test. So, sir, basically, I'll just shine your eye, sir. So, okay, thank you. After doing the Hirschberg, I'll be performing the cardinal fields of the gaze test. So, sir, please look to the tip of my pen light, and I will form a H letter. Please. Okay, thank you. So, alright, after doing the assessment, I'm just going to summarize the information obtained during the working phase and discuss the findings to my client. So, based on the assessment that I've done to you, sir. So everything is all normal. So for your visual acuity, when reading the Snellen's chart, the result was 20/20, which is normal. So for your visual field, the one that I wiggling my fingers, and upward field is 50 degrees, downward field at 70 degrees, and then the nasal field at 50 degrees, which is normal. For the inspection of the eyes, it is aligned and symmetrical. The eyebrows are evenly distributed, and the eyelashes are evenly curled upward. So for your eyelids, the skin is intact, lids close symmetrically, no discharge, no discoloration, and have normal blinking, which is 15 blinks per minute. And anterior lacrimal gland and nasolacrimal ducts, there's no edema, no tenderness, and no swelling also. So your sclera is white, which is normal, and your vulvar conjunctiva is good. Your iris pupil are both normal. The cardinal field gaze test, both eyes are coordinated, no jerking movements. So everything is pretty normal, as what I've said earlier. Just advise to minimize your cell phone screen time, and also drink a lot of eye vitamins, or eat some foods that good for your eyes. So that's it, sir. Thank you for your cooperation.